Hi, welcome to J Sweat Plastic Surgery. I'm Dr. Jeffrey Sweat. You're being asked to watch this video today as a general introduction to the practice. It is our goal here that you are taken care of in a state-of-the-art facility, but also that we make sure that you're comfortable and that all of your questions are answered. This is definitely a team approach. As an individual surgeon who operates anywhere from 3 to 4 days a week, I rely on my team around me to help with your care throughout the entire process. I've also surrounded myself by people who are highly educated about what we do, so oftentimes they will answer your questions. If you have any questions that they can't answer, obviously they'll talk to me and we'll make sure that we have all of your questions answered. But it is important to understand that it is a team approach, and oftentimes throughout the surgical process you will interface with me from time to time, but you will often interface with my staff more frequently than you do with me. And this is so that we make ourselves available to you at all times and any time that you have problems. Obviously, we will provide you with an emergency number that you can call after hours, but when our office is open, it is always best to call the office to get the fastest response. If you have any questions or concerns about the process and how we are taking care of you as a patient here at J Sweat Plastic Surgery, please don't hesitate to ask. Thank you and welcome to the practice. The purpose of today's discussion is to discuss blepharoplasty surgery, or something commonly known as an eyelid tuck. As we age, we tend to have laxity of our skin that can over time impair vision or give us an appearance of being tired all of the time, especially when it is in the periocular or area around the eyes. And oftentimes people will elect to have surgery to contour and remove this extra tissue to give a more aesthetically appealing appearance, as also to look less tired over time. The incision for the upper eyelid tuck is placed in the upper lid crease, and the amount of excess upper lid skin is pinched to slightly avert the lashes in order to remove all of the excess skin. The scar itself tends to be hidden in the upper eyelid crease when the eyes are open, and it tends to fade very nicely with time. When the lower eyelid is also contoured, and as we age, what can happen is the separation between the skin and the fatty tissue in a layer called the septum can relax over time and let the lower eyelid fatty tissue bulge through and cause puffiness of the lower eyelids. So when we do lower eyelid surgery, we almost always remove the excess skin by placing the incision along the lower lash line to pinch out the extra skin, but also to remove some of the fatty tissue to remove the puffiness. On the upper eyelid surgery, most commonly, we're only removing skin unless there's excess fatty tissue of the inner part of the upper eyelid, where we sometimes will contour that as well. The surgery itself is done as an outpatient surgery, which means you're going to come in the morning of surgery and go home that same day. Oftentimes it's done under IV sedation, which means that we'll start an IV in the back of your hand, make you sleepy, and then inject numbing medication in all of the areas where we're going to be working. You'll just snooze through the procedure. When you wake up from surgery, you're going to have little tapes across the bridge of your nose and little tapes out to the side that are holding stitches in place. Those tapes are to be left in place until you see us back in follow-up about 5 to 7 days after surgery. When you get home from surgery, it's important that you relax and take it easy. Keep your head elevated on a couple of pillows. Take a bag of frozen peas or an ice pack and put it on the area of operation for 20 minutes on and 20 minutes off, both the day of surgery and the next day, though you don't have to do it at night while you're sleeping. It is normal to expect bruising and swelling, and that bruising and swelling generally lasts for a week or two after surgery. The purpose behind the ice packs are to help alleviate postoperative discomfort, but also to help to decrease the swelling and bruising that we inherently expect behind the surgery. If we're overly aggressive with the surgery, you can have problems closing your eyelids, or there can be, if there's excessive laxity of the lower eyelid, you can actually have an outturn of the lower eyelid, also known as ectropion. It's important to understand that for every direction of pull, the gravity is going to pull in the opposite direction with the lower eyelid, so we have to be very careful about not overly tightening and creating more problems later on down the road. In fact, I'm going to put stitches on the inside of your eyelids when we do the lower eyelid surgery that's going to help support the lower eyelid and give a little bit of an upward slanted appearance that it lasts generally just for a few days after surgery, but helps to support the lower eyelid while it's healing. Again, the purpose of the eyelid surgery is to help contour and remove excess skin and fatty tissue. But it is important to understand that as we age, we also lose volume in what we consider to be our mid-face. So in other words, this area right through here where your cheekbones are will slowly lose volume with time. As we lose volume of the cheekbone, it also makes the bulging and swelling and skin laxity of the lower lid more obvious. So the surgery itself helps with the bulging of the lower eyelid, and it also helps with the skin laxity, but it does not replace the volume lost through the normal aging process in the mid-face. Occasionally we will treat that volume loss with fat transfer during the course of the surgery itself, but more commonly what we do after surgery is come back in and add filler material such as Juvederm Voluma to help restore the lost facial volume and overall help improve the appearance post-operatively. It is important to understand that while the surgery does help quite a bit, it doesn't fix all of the anatomical problems that happen as we continue to age, and that's why it sometimes is a multifactorial approach in order to fix the problem. If you have any questions or concerns about what I've said, please don't hesitate to ask. Thank you.